Good afternoon, Minnesotans. We're going to be joined here by some medical personnel literally coming off shift. And once again, I think just to highlight the point that these folks are not here to support my position or a position that we've come up with. We're here to highlight what the situation is in the hospitals, is for those care providers, and what we can do to make a difference. Commissioner Malcolm has joined us for any questions at the end. I'm sure that they will brief and put out their information, but it's another unfortunate announcement of 94 deaths. But I think Minnesotans over the last, we were just discussing from March 6th, the first case that showed up. And during that time, Minnesotans have started to understand a little bit about the progression of COVID-19. And of course, as we've said, there's case numbers, then there's a lag period, then there's hospitalizations increase, then there's a lag period, and then there's deaths. It looks like, and again, we don't want to get ahead of ourselves, and we're on day 16 since Thanksgiving. We are on day 21 of our pause. We're looking at that there are some decreases and fairly significant on case positivity. For example, we, I believe, tested around 58,000 Minnesotans today, had about 3,700 positive cases. That's about a 6.5% positivity rate, and that goes clear back to where we were in September and October. That is about what was expected, this peak and coming over the top of the peak and coming down. Now, the question still out there is, what did Thanksgiving do? And at this time, Minnesotans, I think it looks like so many of you made those hard decisions, and you did the Zoom Thanksgiving, and you talked from a distance. It looks like we're making a difference. And I think today what you're going to hear is what those differences mean and what happens if we get this right. But also you're seeing it across the country, whether it be field hospitals in Massachusetts or increasing numbers of Americans dying, of 3,200 yesterday. The last 5 days, we've had over 3,000 die. Here in Minnesota, just to put that number into perspective, we've had over 250 folks die in the last 72 hours. That's approaching what we lose in a year on the highways. So I'm in trying to all of this, we try and get away from just the numbers and put the humanity behind this. We were here on Tuesday with some really good news. That news was good again yesterday, that the FDA scientists approved and are getting ready to finalize. I think it's altogether reasonable that the timeline that was laid out on Tuesday, that shipments should start early next week. And as Commissioner Malcolm said, after some training, and Chris Erzman said, after some training and all of that, that it is very reasonable that sometime around the 20th, 21st of December, that we will start giving vaccines to some of the folks you see up here and the emergency room physicians. It's going to take a little time to build up that immunity. The numbers aren't going to be there in the beginning, but we're headed in the right direction. I'm going to have these folks speak a little bit, anticipating some of the questions. We were hopefully trying to get as much information out as early as possible. I would tell the press that is here, the data that's coming in post-Thanksgiving that we're looking at, the importance of trying to strike the proper balance around mitigation, whether it's in our businesses or youth sports or getting our kids back in schools that I keep talking about has been our top priority for quite some time. I think we're going to need a little bit more time to get this right. We're working with an awful lot of folks to try and gather that data. We've got another week from today until the pause that we put in place ends. We've seen in these first 3 weeks, as I said, I think some significant change, and I want to be very clear about that. Very difficult to attribute that all to just mitigation measures, and we think social response to folks as they see numbers go way up, they start to moderate their own behaviors. Whatever's happening is, it looks like we're coming over the top of that peak. The question will be is how much we come over the top in the next 7 days, and I think the closer we get to that, we want to get out good information, but adjust accordingly. This has been a challenge from the beginning to strike the proper balance between health protocols, not overwhelming these healthcare systems that they're going to tell you about today, is between the vaccines and a lowered positivity rate. It can appear in the general public, well, what's the big deal? Things are going back good. That lag period is all focused on hospitalizations, death, and the pressure on the systems. And that's the thing that many of us don't see. So give these folks a little bit of a time to talk about it. I do think it's important, Minnesotans, though, to say thank you. It appears like you did what was needed in these this lag period, that we're creating a little bit of space, but I want you to hear what it means to these folks, even that little bit of space, what that can mean, but what happens if it goes back the other way. So with that, I'd like to turn this over to Dr. Kevin Croston. He's the CEO of North Memorial Health, for that perspective. Dr. Croston.
Thank you, Governor Walz, and Commissioner Malcolm, for having me here today to talk with you. We're grateful for our ongoing partnership during this great time of uncertainty for our hospitals, our health systems, all the healthcare workers, and frankly, for all Minnesotans. As Governor Walz said, my name is Dr. Kevin Croston. I'm the Chief Executive Officer at North Memorial Health. A little bit about North. Our system has a little over 6,000 dedicated people working at it on any given day. We cover a couple of hospitals, many clinics, and we have an extensive air and ground ambulance network that serves communities across the state of Minnesota. As a level 1 trauma center, we do crisis really well, but I'm here to tell you today that our people and our facilities are stressed and they become overwhelmed. I see the impact every day on them in our hallways, in our laboratories, our ICU and patient rooms, and it's not just at North Memorial, it's all across the state. So, all Minnesota hospitals and health systems have been working around the clock to care for our communities, both those affected by COVID-19 and not to forget those with immediate medical needs and chronic conditions. Our medical professionals are dedicated beyond belief. Their commitment is unwavering, and they're actually really a true and constant source of inspiration to me, and frankly, hopefully for all of you. But they're exhausted. And they're in desperate need of our continued help, and I believe they deserve the support of our community at this time. Our doctors, nurses, therapists, technicians, support teams have all been working at this breakneck pace for about the last 9+ months, nearly a year of pushing to deliver the best care possible under really, really difficult circumstances. They have rightly been called frontline heroes, and while they're indeed demonstrating a heroic commitment and effort every single day, I would argue that the real front line of defense is you and me, everyday Minnesotans. We actually have the power and the responsibility to support those who care for us and our loved ones by following the public health measures put in place by the state. In the lead up to the most recent surge of COVID hospitalizations, Minnesota health systems worked round the clock collaboratively to prepare increasing bed capacity, secure supplies that were scarce, and supporting our staff. We've changed our operations to meet the demands of the virus. We've repurposed our equipment. We've cross-trained staff. We've postponed non-essential but time-sensitive procedures to make things work. And for the most part, it has. Our preparations have largely been successful as we've cared for record numbers of people during the fall surge. But in all honesty, we're watching right now with wary eyes. As uncontrolled community spread from holiday gatherings will put our already fragile healthcare system under increasing stress. And we're still concerned about having the capacity needed to deliver both to COVID and non-COVID patients. When one stops, the other one doesn't necessarily stop. So we've got a pretty steady supply of folks. In addition to serving as Chief Executive Officer, I'm also a practicing surgeon, and I bring that viewpoint to our COVID-19 experience as well. I'm acutely aware of the impact of delaying or deferring surgeries due to COVID-related surges that require us to make difficult decisions about prioritizing life-saving care. We carefully make those decisions, sometimes on an hour-by-hour basis, based on care capacity, because we have firsthand seen negative consequences for our patients and their families who need these procedures. We don't take this responsibility lightly and are trying to ensure that everyone gets the health care they deserve. I know that this has been a long road. I know that we're all tired of this and all anxious to get back to normal life. And I do believe that that's in sight. As the governor alluded to, as soon as next week, we're going to be administering vaccinations to healthcare workers across the country and to the rest of our community in the months following. We're all hopeful and looking forward to the day when we can gather together again, hug our loved ones, return to the activities we enjoy. Believe me, our healthcare workers are looking forward to that as well. But We're not there quite yet, and we need the continued support of Minnesotans to get there. Our healthcare systems still need your help. If we don't take care of them, they can't take care of us. So please continue to stand up for them by following the public health guidance, especially through the holiday season. There's a few simple things. Wear a mask outside your home. Follow distancing guidelines. If you're sick, stay home. Get tested if you're exposed to COVID, and choose technology over in-person gatherings whenever it's possible. These simple steps make a world of difference, not only for our healthcare workers and families and facilities, but also for you and your loved ones should you need care. Please take this seriously, and thank you for supporting our Minnesota Health family. I also want to take a minute to thank Minnesota Hospital Association for supporting collaboration and coordination among the hospitals and health systems, and to support the best care for Minnesotans. Rahul Karani and his staff have done remarkable work, and it's been meaningful, and you'd be proud of the collaboration between the health systems. And I want to also thank Commissioner Malcolm and Governor Walz for their continued leadership, partnership, and support during these ridiculously difficult times. Thank you. I'm going to introduce Mimi Keeler to follow me here.
Hi, my name is Mimi, and I'm up here because I'm an essential worker. I'm a nurse at St. Joe's Emergency Department. You're wondering what it's like to work in an emergency department during a pandemic? You just can hardly imagine. I speak for all healthcare workers, I believe, when I say that we do this because this is truly what we love to do. We love to care for people. But I'm here to tell you that we are exhausted, we are spread thin, and we're getting sick, just like everybody else, and overworked. Short-staffed, which leads to more stress. But I believe that it's our job as Minnesotans to not only care about our immediate families, but to care about our community, disenfranchised populations, neighbors, and our essential workers. Storefront people are working in gas stations. We need all of our frontlines people to be protected. So that is the responsibility of Minnesotans. We need to take care of each other. We need to follow protocol and wear our masks. So a couple things I want to talk about was like a patient. How is the pandemic affecting our patients? We have no visitors allowed at the hospitals. So imagine going to the hospital with your mother who is scared, not feeling well, COVID or general med, or chronic problems, whatever. When they get there and they're told at the front door that the visitor can't go in with them, they're frightened. They're used to having somebody there with them and they should be able to. We can't do that. We can't do that while we're in the midst of this pandemic. We need to lower the curve. Isn't that it? Lower the curve? So we need to be, it's putting a great strain on everybody, including our families. I'll tell you a story about some of the other things that are happening. Because the hospital is used to having ICU beds turn over at a certain rate, maybe 3 to 4 days, with COVID patients filling up the beds and not discharging in that timely fashion or predictable fashion is putting remarkable stress on the beds that are available in the hospital. So what that means is across the Twin Cities, we could be in a situation where we need to find a bed for this woman I was talking about who came into the hospital on her own, leaving her son, came through emergency department and needs to be admitted. We can't find a bed for them in the Twin Cities. They may need to go to Duluth. They may need to go to Red Wing. Just think about how terrifying that would be for family. And one day I had a patient who required critical care. Lots of medications, lots of monitoring going on in the emergency room. We do that all the time. We stabilize patients, that's what we do. And then we send them to, in this case, it would be the ICU. ICU bed's not available. Patient is requiring critical care, nursing, and doctors. And we're having to keep them in the ED, emergency department, with us for up to 8 hours. Can you imagine the stress that puts on the patient, on the staff? It's scary. It actually, our patients deserve to be able to have the care that they need. So my call to action with you is to ask you to wash your hands, social distance, wear masks, following the guidelines that the state of Minnesota has put out for us, and just avoid gatherings. I know it's hard to do Zoom or to do distance holidays, but Christmas is here. It'll be back next year. And then we can have another Christmas maybe with a family intact. This year, we're gonna need to do it at distance. So I just wanna thank you and make sure, call to action is to ask you to do those things, follow the state guidelines. And I am going to introduce Dr. Bornstein.
Thank you, Governor Walz and Commissioner Malcolm. And also thank you, Dr. Croston and Ms. Keeler. Your stories are important. My name is Dr. Peter Bornstein. I've been asked by the Minnesota Medical Association to come and share some of my experience. I'm just one of thousands of Minnesota physicians who've been caring for patients who are your neighbors, your friends, and maybe even your family. I work for St. Paul Infectious Disease Associates. My 8 colleagues and I provide infectious disease consultation at United Hospital and St. Joseph Hospital in St. Paul, at St. John's Hospital in Maplewood, and at Woodwinds Health Campus in Woodbury. We were also the infectious disease consultants at the Bethesda Hospital when it was the COVID hospital. There's no possible way I can share the entirety of my experience with you in a few minutes, but there are a few cases that come immediately to mind. The first was an elderly man at United Hospital. This was a few months ago before the most recent surge. He had spent the waning days of summer up at a cabin with family. A week later, he came down with a dry cough, fever, and worsening shortness of breath. Now, this sounds like hundreds of cases that I've seen in the last 9 months, but the reason I remember this one is that he was also a former colleague. He was a radiologist, a retired radiologist. He knew what the chest x-ray findings meant, what those shadows meant. He knew that at his age, in his 80s, that his chances of survival were not that great. He was fighting back tears as he was asking me about treatments, about steroids, which had just been recommended, about remdesivir that has, at that point, was under emergency use authorization. Fortunately, thanks to the skilled care from the hospitalists and the nursing staff at United Hospital, he pulled through. But it really could have gone either way. The other case I will share with you took place at Bethesda Hospital in the ICU. I was asked to see a man in his 60s, already very critically ill, on a ventilator because of respiratory failure, on medications to keep his blood pressure elevated because he was in shock. He was still running high fevers, and he had been there for a week, maybe 2. The intensive care staff asked me to see him because they were looking for any help to see if we could turn around this desperate situation. So after carefully putting on my N95 mask, actually it was on pretty much all the time at Bethesda, a gown, gloves, a full face shield, I stepped into his ICU room. It was just him and me. Now, ICU rooms usually have some noises, not the beep, beep, beep of heart monitors. That's Hollywood stuff. That doesn't really happen. I heard the whoosh of his ventilator. I heard the hum of the HEPA filter air purification system in his room. But there was another sound I heard, crying. Now, he wasn't crying. He had a tube down his throat. He couldn't say anything. And it wasn't just crying. It was sobbing. And I looked around the room to see if there was someone else there, and nobody. And as I walked to the far side of his bed, I realized that there was an iPad on a stand at the height of his bed. And on the iPad was a young woman watching her father, and she was crying. And without a doubt, the hardest part of our job, I think for all of us, is not the intellectual part. It's the emotional part. Watching the separation of family from their loved ones, as you heard from Mimi. This story didn't have a happy ending. The patient died of COVID-19 a few days later. We who work in emergency rooms, in ICUs, in the hospital wards, physicians, as well as nurses, nursing aides, respiratory therapists, even the people who clean the rooms, we are tired. We have been working double shifts, days without end, for weeks, if not months. And we need your help. There's been a lot we have missed this year. Graduations, my own daughter graduated, no graduation. Weddings, maybe funerals. I've missed hugging my children, I think we all have. Those of us who are empty nesters anyway. We don't want to risk infecting them, and we know they don't want to infect us. And while there's good news about vaccines, it appears they're likely coming very soon. It will be weeks and months before they are completely distributed and administered enough to have an impact in reducing the transmission that is filling our emergency rooms. Behind every death, there's a family and a story. But beyond death are the thousands of Minnesotans who get sick and need our help. Please, help us help you. Keep wearing the masks, keep doing the social distancing, keep using hand hygiene. I will still do all of those things even after I receive my immunizations, because we are all in this together, and we will reach the end of this trail together. Thank you. Governor?
Thank you, Dr. Bornstein, Dr. Croston, Ms. Keeler. I would highlight that, as Dr. Bornstein said, it's like in life, we're all on our own journey, but we're in it together. I think the thing, if I could stress enough, is a little kindness at this point in time to understand that everybody's journey looks a little different and they're doing the best they can. Over the last couple weeks, I've stood with people, as I said, not that they're standing and supporting my position, I'm standing and supporting their position, whether it's these folks telling the stories of what it looks like in a medical facility, or with police officers, firefighters, National Guard, folks who had family, who they lost, or folks themselves who recovered from COVID-19. Again, I know this is so incredibly challenging and so incredibly frustrating. And to try and kit all of the pieces of this, because the things that we do to mitigate the risk of COVID-19 have their own impacts, whether they be economic, mental, social, those things all happen. And over this journey, we've tried to figure out, how do we strike that proper balance? How do we make sure we can do as many things as we can that bring joy to our lives, help us with our mental health, but also making sure we don't overwhelm and we don't have a situation where there isn't a bed waiting for there if you need it. Or, God forbid, an avoidable death is not avoided because of the things that we did. So I know this is hard, and I obviously try and get as much information from folks, and I can't help but I was thinking back, how do you get people to do these things? How do you talk? Somebody asked last week, what do you tell people who are doing all the right things? What do you say to them when they know somebody else isn't? These are things that challenge me. I believe that the vast majority of Minnesotans believe the science behind this. They deeply care for their neighbors, and they're trying to do the best. But I want to be very clear. Trying to figure out a way to see your family does not make you a bad person. It actually makes you a very good person. To try and figure out a way to have your kid get some exercise and have some joy of youth sports does not make you a bad person. It makes you a really good parent. All of those things are coming into a clash. And I was thinking back, some of you are old enough to remember, trying to figure out how to make sure our kids are not using illegal drugs. And the campaign that First Lady Nancy Reagan used was, and it was the right spirit of it, but it was just say no. But that's not enough. We found out it's not enough. You got to give people the tools so they know what to do. And you have to recognize that people need to be well informed to make those decisions. So one of the reasons of bringing these folks here and continuing to try and talk with you Minnesotans is to try and figure out where that place is at, where that line is, and what we can do. We're close. We're getting closer. But Dr. Bornstein's right. It's going to be a while. And each of these folks told you there's things that we can do. And those things have been around from the beginning. And they're not the most draconian of things. They're the things like wearing the mask and washing your hands and social distancing. Now we've made it easier for you to get a test. And we should make it easier for you to be a business that's doing the right thing, because you're a business that, just because of the nature of it, the virus spreads more. There needs to be support there for you. I was just discussing today with one of my staff, like preparing for a tornado. We have the National Weather Service. We try and predict the weather. If we see one, we blow the siren. People make responses. But if it hits, we clean up and we do the things. Unfortunately, with COVID, you can't see it and it doesn't hit. And unfortunately, it doesn't hit all businesses equally. It's like a tornado that went through and hit restaurants and left other buildings standing. That is horribly unfair, and it causes immense economic pain for those folks. That's why with so many things, it's called neighborliness. It's a functioning society. We share that. So I will make my plea. We in Minnesota need to pass a piece of legislation that provides for those folks who are helping slow the spread and can protect their business, and those workers who were laid off, why they're protecting these workers to stay there. And the federal government has had 9 months since they've moved on anything. They need to move. They need to figure this out. It's absolutely outrageous. And I don't care if it hurts their feeling. I've been there. I know what it is. Do the job. Do the job you were sent there. For goodness sakes, don't be signing on to stupid pieces of paper about things that don't matter. Figure out how to get us help out here for these hospitals and businesses and workers. And that's what's in front of us, Minnesota. So I want to thank each of you. I am hopeful because of what we saw happening and the numbers coming down, but we've got work to do. With that, questions? Governor,
Given what these folks just said, and can you hear me? We've got these new mics here. Can you hear me?
Yeah, I can.
Okay. Your restrictions are hanging in the balance. You were here on Monday and you said you hope to have guidance for them by today to give them a week to plan. Now your announcement is on Monday. Can you give the businesses some guidance today? Will the businesses that are closed now stay closed after next Friday?
Yeah, and this question, I think, you're all mic'd now, so I won't have to repeat. This is the most challenging thing, and it was our intention to try and give as much lead time. Our pause went into effect 3 weeks ago. And as I said, I think, and again, I'm certainly, this is Minnesotans who need to claim credit for this, it looks like behavior's changed, whether it's because of the mitigation or because its numbers were spiking, doesn't really matter. It looks like there was an impact there. We got another week to see what that impact is. Again, in an ideal situation where there would be enough mitigation money or help, you would try and continue to use those mitigation measures, but I'm trying to strike the balance of how do we protect these folks and protect those businesses? And just candidly on this, I think that data is still coming in. And what I would tell businesses is this: I am doing everything possible. Those who are angry, those in the restaurant industry, you have every right to be angry. This is horribly unfair. The virus hits where people sit in close contact with others for long periods of time. That happens to be the basic definition of a bar and a restaurant. That's what's happening here. So what I would say, and I would tell Theo and tell everyone here, my intention is to try and get this as soon as possible, this information, but we've got to try and get it right. We've got to have the experts in. We've got to hear from the folks in the industry. Again, I was sent testimonials by Hospitality Minnesota that are hard to watch because these are businesses that are hurting, but it's striking that balance with these stories that are hard to hear too. So what I would tell you is we will do our best. I would anticipate sometime next week. It would be my hope that we pass a package of relief on Monday that could help us inform where we could strike the proper balance to make sure we're protecting these folks.
One of the things I've been told that you're deliberating on is restaurants, whether to move them to 25% open or whether to keep the dining rooms closed. Is that true? Are you looking at that kind of
There's
thing?
a whole lot of things we're thinking about, and I think in fairness to those, excuse me, to those restaurants, I'm trying to figure that out. Again, with the understanding of what we know about epidemiology and infectious disease experts, where is that balance where that starts to spread? Because every time we turn that dial to open, that does mean potential for more infections, more hospital beds, more folks sick. As we've said from the beginning, we can't shut things down indefinitely closed. It doesn't function both economically, nor mental health, nor physical health wise. So I would tell those folks, we are trying to consider everything. And no decision has been made. I was not prepared, and this falls on me today. I am not comfortable making that decision today because the data is still coming in from the pause. And I think these folks, those businesses and Minnesotans deserve to us to have the most up to date. Now, I do know that causes the unknown and the uncertainty. That makes it more difficult. In this case, I think Minnesotans, I hope you would agree, we need to get this right with the most current data. And there's a whole lot of things intersecting at the same time in terms of some of the highest rates in the nation, in the world, but also vaccines coming out. Plus, I watch every single day. I live by, I would have never imagined that I would know where all the ICU beds are, how many there are, who's staffed, how many of the staff. And as I think Dr. Croston said, the collaboration and the organization between Minnesota hospitals, other states are coming in here asking them how this is done. And that's been helpful. So I'll try as soon as we can. Other questions?
Governor, do the pending lawsuits over your closures of fitness centers and youth sports, are those having any bearing on how you're approaching the decision about whether to lift restrictions or modify restrictions?
No, I'll follow the science. I respect people's rights. This is exactly their constitutional rights to challenge these. I respect what the courts come out with. This has been going on from the beginning. I've got folks that help me make sure that we're balancing the constitutional rights, the legality, of trying to get this right. I certainly respect people's their rights, and they're bringing these up because they're hurting. I would just ask, and I think most Minnesotans hear this, is I'm trying to balance that against the stories you just heard here. I'm trying to balance that against how many hospital beds are full. I'm trying to balance that against the 94 deaths, and I'm trying to balance it against the science of, can you put 25% of people into a restaurant and not see numbers go up? Because if the answer is yes, you should do it. The same thing I'm trying to figure out, we need to, if we can get, and it looks like we're getting that data, get K-5 kids back in school as quick as possible. So it's not the lawsuits. I certainly respect them for that, and the courts will rule accordingly, and we will respect what their decision is. But this is predicated on the safety, security of Minnesotans and balancing that on the economics.
WCCO here. So some restaurants and bars, which I'm sure you've heard by now, have opened anyways, regardless of your restrictions. What do you say to the business owners who have opened up their dining rooms currently in the state of Minnesota?
Yeah, well, first of all, I say I understand where their frustrations are. I also understand civil society can only function when we agree upon some basic principles. They've got every right to go to court, and if the courts determine that this was the wrong decision based on public health, wrong decision based on constitutional rights, then we will go accordingly. At this point in time, that's not happened. And I think, the message I would say is, I understand where you're at, but you also have to understand from these folks' perspective, I would say, is every time we do that adds the potential for more people into the emergency room, makes their jobs harder. I had National Guard, firefighters, and police say, make our jobs a little easier, support us, don't do these things. So we will follow the procedures. Health will do what they need to do. We'll follow the proper procedures. I do just want to say I certainly can understand their frustrations, but like so many things in a society that's ruled by the rule of law, you follow the procedures that are out there. At this time, that is a lawful move under Chapter 12 of Minnesota statutes that's granted by the elected legislature, and the courts have upheld that in every single instance. Yes.
Hi. Is it lit up? There you go.
There it is.
Yeah.
Hi. Can you say anything today about what you plan in terms of limitations on social gatherings through the holidays at the end of the month?
Well, I don't think with any specificity, but I would say I would just simply say, I think, again, I don't want to get ahead on this, Jan. I think that Minnesotans responded incredibly well over Thanksgiving, at least the data at this point, 16 days in, appears to be so. And so looking at where our numbers at, looking at where our positivity rates, looking where our ICU capacity is, as I forecast for the last couple weeks during this pause, that I think it would look fairly similar, but that's where we're in right now. And again, if we can create something where families could gather outdoors, again, I know it's Minnesota, but a pretty hardy bunch. People have put in fire pits, they put in heaters. Those are things that we're trying to look at, and those are things that health is trying to help us understand. But at this time, no decisions made.
And just to follow up on that, is there a 7-day average you're looking for? Like that if you got to 2,000, that maybe?
Well, yeah, and I think health would tell us there is, that we're looking for that 7-day average. Jan, if you want to talk a little bit about this, the one thing I would say is much like what we did with our Safe Schools plan, is to try and use that data coupled with other things to reach a compromise position that does both protects health, but gets the activity closer to what we're trying. But Jan?
Thank you, Governor. I appreciate the chance to talk just a little bit more about this. I want to reinforce something important that the governor said. We're 3 weeks out from the 4-week pause. We're only 2 weeks out from Thanksgiving. And what we've said repeatedly is that it really takes a full 4 weeks to see the full effect of some, significant environmental event, policy change or the like, or a holiday. So we are very encouraged, just want to reinforce what the governor said about the trends that we're seeing, but we've not yet seen the Thanksgiving impact fully. And I know folks are saying, we have, and we've avoided a Thanksgiving bump. It's just too early to say that. So I think the governor's wise to wait for as much data as he can get. And I just also want to say, we have all gotten used to these high numbers, and we are very grateful that the increases have slowed and come down a bit. We're still, it boggles my mind really to think that 3,000 cases in a day feels like a good number to us. This is still an extremely high rate of virus in the communities. You asked about what would be the target. Nationally, not just Minnesota, 10 new cases per day for every 100,000 people is considered the sign of an out-of-control virus. We are at 85 cases per 100,000. That's way lower than we were 3 weeks ago, to the governor's point. We've come down from near 120 cases per 100,000 people. But we're still many times over what we would consider to be the high-risk threshold. So I think that just goes again to the difficulty of striking this balance of absolutely wanting to, to make things possible where we can. But I just have to keep being the bearer of less than good news to remind us that that even with this improvement that we've seen in the last couple of weeks, we are still at a very, very vulnerable place.
Governor, special session Monday. There's a deal now on business relief, but no deal on unemployment extension. Would you sign a bill that only includes a 5-week extension of unemployment insurance, or are you holding out for the full 13 weeks?
Well, I'm not going to speculate in the middle of the negotiations. What I can say, and I'm just going to be very clear, thank you to the legislature for coming on this. I think that they're very close. I think part of this is what our goal is, and the goal is pretty simple on this: provide relief to those businesses that are doing what they need to do to protect public health and also to provide relief to those workers who need it. It's my opinion that the best way to do that was to put together a pretty robust package and get that money out to those businesses by the end of the year. We still have a chance to do that, although this is taking too long, but that's the nature of deliberative bodies. But we're close. And to extend unemployment insurance, because once again, I think, and I don't blame them for this, I think legislators were looking at and saying, well, it's really the federal government's responsibility to do that, which it is. But again, I certainly wouldn't let any of them walk my dog because I wouldn't trust them for it would come back home at this point. I am just fit to be tied, and having been a member there. So I think it's absolutely critical that Minnesota put that in. And if they give people some security around that, the 13 weeks of unemployment, if the federal government comes in, then they can do that. So I don't want to speculate where I'm at. What I do want to tell Minnesotans is, and the legislators know this, DC's dysfunctional, and they're holding up things and holding to a point. Let's get a compromise, help businesses, help people, make it decent and move it on. And again, we have a track record here of doing that. We have a track record of divided government of doing that. The story that got lost this year was we moved a bonding bill in the middle of a pandemic in a really bipartisan fashion. So I don't want to speculate and upset where they're at. I would give them my principles were this: provide relief to the businesses, provide relief to working families, provide some relief to the most vulnerable in Minnesota, and then let's come back again next year.
Is $216 million for businesses enough? You were originally talking, you never mentioned a number, but I think you were higher than that.
No, it's probably not. But again, I want to thank the legislators, and I don't want to get into their space on this. They reached a compromise that worked. And so what I would argue is if that's what Minnesota can move, just to be clear on this, at least as of right now, it appears of all 50 states, we're the only one that are moving a state package to help. And I just heard all kinds of governors, Republicans and Democrats, on the news right now just screaming at DC. And I'm like, I'm with you, keep screaming, but that's not good enough. So what Minnesota can do isn't going to be enough. It's not going to be as robust of what the federal government can do, but it is going to be a lifeline. Because again, those businesses who are shutting their doors, and whether they are angry and filing lawsuits or whether they're doing it and just waiting to come out the other side, all of them, if there was some relief for this, again, I keep thinking of this. These folks are closing their doors to protect the healthcare system, to protect the frontline workers, to protect their kids, to protect their neighbor. And if our businesses and if other things were not hit, we can help them out. So I think, no, it's probably not, but I can tell you what, it is a robust package that is being done in a bipartisan manner, and it's the only one in the nation that they're doing it. So I'm proud of the work they're doing. We just need to get it done and sign it into law in the next couple days.
And Governor, will you sign that even if it does not include an extension of unemployment benefits for people whose benefits are running out?
I'm not speculating at this time. I would just say that I don't know how you would go home not providing aid to those folks. And again, it is not the Minnesota legislators' fault, regardless of political ideology on this. It is the federal government's fault because they have not extended that. And again, you can't just wish away the pandemic. And I can't stress this enough. Businesses aren't going to come back if you got a sick population. Businesses are not going to come back and do things if hospitals are overwhelmed or their workers aren't there. Again, I want kids in schools, but I got to figure out to make sure the teachers and the bus drivers and the cooks and the custodians don't get sick along with the kids. And so at this point in time, I'm not going to say we need to provide that relief.
Are the mitigation measures part of the negotiation with the legislature?
They are not. And I'll just candidly, early on, there was some talk that no deal would be made unless I got rid of the mask mandate and took off all mitigation measures. Well, that's not going to happen. It should not happen. It's part of what we're doing to keep businesses open and to keep the economy going. So I would say that I think that early demand was more for optics sake, and then now we're getting down to this. But no, certainly not. We have to do the measures that make a difference, and certainly there's been disagreement on that, but speculating that you just want everything opened up when we know what the end result of that is, that is not part of what we're talking now. Got time for another one?
And Governor, given the unfortunate number of deaths, do you foresee the need to use the overflow morgue space that the state has purchased?
Well, we don't know. The facility was, again, it was all of the area medical examiners, funeral homes, we're anticipating early in the spring with the numbers we were seeing, what we were witnessing in New York and elsewhere, to have that facility available. A few weeks ago, there was a request made, but we were able to move things around. The equipment has been tested, and I would say this again, much like every insurance policy, what we knew at the time and what the implications were for the dignity of Minnesotans, that's a decision that I would make every single time again. We do expect that those are federal FEMA dollars that will reimburse for that cost. And just like so many things in Minnesota, we move properties every year, so there will be an opportunity to do something. But here's I think the biggest success, and I'll go through any amount of political bashing on this. If that facility is not used, that's a success. All right, well, Minnesotans, again, thank you. Thank you to our healthcare. You're representing thousands, and many, and again, are out there right now doing this. We're in this together. Nobody likes it. It's a long journey. We're tired. The virus doesn't care that we're tired. The virus doesn't care that we're arguing. What we do know is we've learned a lot. We can slow the spread. We can open as many things as we possibly can. We are vaccinating right on the horizon next week. And so there is an end. There is an end state. The question will be how much damage is done between now and then, and we have the power to alleviate that. So for Minnesotans, I would ask you, give us a few more days to look at what's happening, as Commissioner Malcolm said. I want to make sure that what we're seeing, and I believe you did it, that you bent that curve some, that you made a difference in infection rates, and that should start to bring down the pressure on these folks coming out here a little ways. But it's just, I need a few more days to see if that data is trending in the right direction, because that will influence these decisions that we're making around mitigation efforts. But once again, all of those things are less impactful than wearing a mask, social distancing, washing your hands, getting tested if you're sick, and then isolating and quarantining if necessary. So thank you all, and have a good weekend, Minnesota. Thank you, everyone.